I'm Liv Evans. I'm the clinical coordinator for Hospital in the Home at Vitalis. So as Heath, we provide services to patients in the community for things like IV antibiotics, complex wound management. We look after PICC lines, we do blood pathology. A lot of the time we have patients that have just had recent infections, so they need IV antibiotics, or we'll see them after if they need wound care, for example, as well, post-op, or if they've had an accident or an injury that requires wound care. We see patients for a whole range of things all over Sydney really. Northern Beaches, eastern suburbs, Western Sydney, North Shore. So it's under their private health insurance, and the hospitals or their GP will refer to us, and then we'll have a look and make sure they're eligible and then take them on. And then we normally see patients either at home for the first visit or in hospital for their first visit. It means that patients are able to go home from hospital earlier on and not have to have prolonged hospital stays. And a lot of the time it means that patients are more comfortable at home, things like that, which does help their recovery. Hospitals are quite a scary place, and so it helps psychologically for their healing, but also I think as well it's nice for them because it means they can get back into their daily routine and do things they normally do and not have to be in hospital and put their life on hold.
My name is Vonnie Layton and I'm the clinical director and co-founder of Vitalis Health. Such a privilege to walk into somebody's home to provide them that care. We're being invited in, and therefore we have to give them confidence that we're coming in with the very best of intentions. And I want our staff to feel that they're walking into their mum or their dad's home, or their gran or their grandpa's home.
In order for the patients to feel comfortable and feel like they're getting the best care, we try to build rapport. And I think as well, when people are sick, it's like a very vulnerable time in their life. It's very scary, especially if you don't come from a medical background. And so it's really important that they feel like the nurses, that they can ask the nurses anything, and that they're comfortable with their nurse and that they feel supported by the nurse. And I think it's also nice for the nurses because a lot of the time as well we'll see patients every day, so the nurses will be able to form a relationship and see the patients quite a few times a week and watch them progress and get better.
And so our clinical educators, who are very experienced nurses, work with us in the classroom, at head office and at the patient's bedside, sometimes even in the hospital, to train our staff, to vitalise them really, to get them really delivering that care the way that we want for everybody, and to a standard that satisfies us not only as if it was our mum and dad, but also that meets our accreditation requirements.
I don't think I could have navigated the challenges of this year without the support of Vitalis. Obviously medical, but psychological, emotional, that sense of well-being that they've allowed me to have in what's been a very challenging year. It's been very, very important to me.